Hello, this is Dr. Marty Klein with more sexual intelligence. Lots of things in this world undermine sexual satisfaction. Today, let's look at some sex-related words that we should redefine or eliminate altogether. Lay people aren't the only ones to use these unhelpful words. They're also used by doctors, journalists, and even therapists. Together, they add up to a narrative of sex as problematic, even dangerous. And the first is ED, or erectile dysfunction. Too many doctors and civilians define this as if you ever can't get it up when you want to. But there are lots of reasons that fully functional penises stay soft when we want them hard. Anxiety, alcohol, resentment, embarrassment, definitely anxiety. I would replace ED with I don't get erect when I want to, or I lose my erection when I want to keep it. That would locate the problem more accurately, not with the penis, but with the guy's expectation or his mate's expectation. Second phrase is low desire. Now, there is such a thing as low desire, but it shouldn't be measured by simple numbers, and certainly not in comparison to someone with higher desire. Because the question is, desire for what? Is it desire for sex that's boring, painful, too fast, or with someone who has drunk too much or hasn't bathed in a while, or sex in a place that looks or smells like it hasn't bathed in a while? That's not low desire. That's sensible. If you want to evaluate your or someone else's desire, imagine a sexual situation that's ideal or ideal for that person. Then ask how much sex you or that person wants. If the answer is very little, now that is low desire. Otherwise, that's a person who turns down what they don't want, which all sensible people do. The third phrase is too long to orgasm, to which I say, too long for what? People only say this if they're bored, or if they're anxious that they're not doing something right, or both. No one complains that it takes too long to eat ice cream. There's no right amount of time that sex or orgasm should take. If you feel frustrated about what is or isn't happening during sex, discuss it with your partner. Of course, with curiosity and warmth, not with criticism or self-criticism. Phrase number 4, to finish, meaning to orgasm. The obvious implication of this usage is that sex isn't finished for someone until they climax, and if two people haven't climaxed, the sex is incomplete. But many people of all genders don't climax every time. Sometimes someone wants to climax, but their body doesn't cooperate. And at some point, attempting to orgasm becomes more trouble than it's worth. The smart thing to do at that point is to stop. Unfortunately, many people don't, and they continue flogging their own or their partner's genitalia until no one enjoys what's happening anymore. While we should typically support our partner's interest in orgasm, we should also believe them if they say, "It's okay, I'm good." Can your partner be trusted if and when they say that? Now, the fifth expression is perform or performance. Now, the sad thing is, performance really does describe many people's subjective experience of sex. They have a set of objective standards that they feel obligated to meet and that their partner should meet too. And how well they do so plays an outsized role in their experience of sex. Instead, I encourage people to discuss criteria like, did I enjoy it? Did I feel close to my partner? Was I relaxed? Would I like the same experience again? Then we have, what does my fantasy mean? And to answer this question, I don't need to know what the fantasy is. The answer is, it means nothing. It simply means that you find it entertaining to think a particular erotic thought. A fantasy has no more meaning than a preference for vanilla ice cream over chocolate ice cream. Now, some people can't seem to stop having a particular fantasy, and sometimes it's quite unpleasant, like being cheated on or being forced. For them, mindfulness can be quite valuable. Discussing it with a professional is often necessary. Maybe the issue is that someone is obsessive or chronically anxious, and the content of the obsession itself is more or less irrelevant. Now, number 7 is sex addiction. Now, that is the ultimate non-scientific, moralistic, unhelpful sexual expression. And now it's applied to people who cheat on their spouse, who want more sex than their partner, who go to sex workers, who prefer masturbation to partner sex, and who desire sexual activities that their partner or their therapist or their doctor or clergy person thinks are weird. Addiction involves physical dependency, a need for increasing dosage, and withdrawal symptoms when the substance is unavailable. Sex fits none of these. Just because some people take risks for sex that other people find confusing does not make it an addiction. Similarly, repeatedly choosing to do something that isn't good for you doesn't make someone an addict. Ordinary people make such choices all the time in recreation, health, finances, and relationships. That's the human condition. If someone really can't help themselves, which is highly unusual, and their choices happen to involve sex, maybe they have an undiagnosed mental health issue, obsessive compulsive disorder, bipolar disorder, depression, or anxiety. And finally, number 8 is normal. Normal, as in normal desire, normal penis size, normal fantasies, normal preferences, normal ways to masturbate, normal sounds during orgasm, normal anything. Normal could be the worst word ever applied to sex. For starters, every idea about what's sexually normal is a cultural artifact. Some cultures think tongue kissing is unhygienic and gross. Some cultures think monogamy is crude, selfish, and completely unworkable. Some cultures are certain that women lose their sex drive after menopause, and they consider that women who don't are freaks. Then there's the question of how much variation in any one dimension is normal. For example, it's common to have sex 100 times a year. That's twice a week. It's also common to have sex once a year. Yeah, really. Now, that's an enormous variation in what's common or normal. Similarly, some women like to masturbate to fantasies of soft breezes and meadows, relaxed days with a gentle gentleman. On the other hand, many women like to masturbate to images of coercion and violence. These are fantasies, remember. Now that represents enormous variation too. The only answer to which of these is normal is both. When patients ask me a question about what's normal, like what's the normal frequency for couples like us, I don't give them a straightforward answer. Because behind most questions about what's sexually normal are unasked questions that are even more important. I'd rather help people by challenging their desire to know what's normal. When people understand that desire, rather than insisting on satisfying it, their sex lives, indeed their entire lives, are changed forever. Well, thanks for joining me. I'm Dr. Marty Klein, and I drop one of these little videos every 3 or 4 weeks. So if you like, click subscribe below, click like below, and while you're at it, go visit my Instagram page. Thanks very much for joining me.